All right, we have a fair bit to address, and we have a fair number of announcements in the beginning before we get into our direct content. So I'm going to kick us off. Welcome again, friends, to the public terminology calls for the Gravity Project. We will be addressing digital literacy and digital access concepts as we have in previous meetings, and we look forward to having you join us to continue this work. Again, I'm Sarah DeSilva, the Director of Terminology for the Gravity Project. It's good to have you all here. Next slide, please. We always state this, but if there's any new members, thanks for joining the community meeting. We usually mute attendees upon entry. We ask that you remain muted just to avoid background noise and to make the conversation more intelligible to people on the call. The calls are always recorded and located on the Confluence under the sections of meetings recordings. You can find them all there. And everyone's encouraged to chat, and I do my best to ensure that I'm integrating elements from the chat into the conversation. And the great thing is our groups have been, since we focused this meeting specifically just on terminology, our groups have been small enough, it's been easy to have collective conversations. So we look forward to having the same thing again. Just if you do put something in the chat, just make sure it goes to everybody. Next slide, please. These are the antitrust practices. I am not going to repeat them in full this time. I did it the first few meetings, just know that Gravity Project has the responsibility to comply fully with federal and state antitrust laws. Next slide, please. Thank you, Sarah. A note, I don't think we have this slide anymore. Pretty much most relevant links in the conversation, the amazing team at Gravity was going to put in the chat so you can find them. Sometimes you have to click twice to get to the link out of Zoom, but the past meeting materials are now in the chat for reference. These are our 2023 project members and sponsors and partners. Incredibly grateful to all of them. We would not be able to do what we do without them, and always a nod to the in-kind support we get from the AMA above their monetary support and Civitas, Network for Health, and Saffron Labs. Next slide, please. There's a lot of Sarah on the call today, so announcements. But do know that as we talk about digital literacy and digital access, we have a couple SMEs on the call today. We're glad to have them here. And really, this is should be presenters, should be all of us, because by now, once we get into the concepts, we'll be having a pretty robust conversation. Next slide, please. Next slide. Just general announcements regarding other Gravity work streams and HL7 work. So the STU 2.1 publication expected later this summer. We really want to encourage everybody to attend the biweekly implementation call and Connectathon workgroup meeting, which is from Wednesdays from 1 to 2. We really are looking forward to the Connectathon happening, the CMS Connectathon. This is like in the next topic there. Upcoming Connectathons are the July one. It is virtual. This can access with access. We will be leaning into eligibility use case testing and with our partners at MITRE. Anybody who wants to know more about that should go to those Wednesday IG calls, because this is where that topic is being directly addressed. Again, all of those calls, both this call and the IG call, can be found on the HL7 calendar. More at that at the end of the meeting. Of course, there's also the working group meeting in September for HL7 in Phoenix, Arizona. All these announcements are on the Confluence. Next slide, please. This is just a continual announcement. This is the last time we'll give this announcement. The revision of the inpatient quality reporting social drivers of health measure is out for public comment. As just a disclosure, I co-lead that revision of the measure for CMS. The reason why I was asked to do that is because it heavily references Gravity's approaches. So the measure title is the Addressing Social Needs Electronic Clinical Quality Measures. It's initially focusing on inpatient quality reporting, but might be referenced for other outpatient reporting and time. It's a screen and intermediate measure. It focuses on food insecurity, housing instability, and homelessness, and transportation insecurity, and utility insecurity. Notably excludes the previous approach to interpersonal violence because of the adaptation of the HIT screener that's in the AHC tool. Anyone who was part of our elder abuse and intimate partner violence domains remembers that well. So just the socioeconomic domains you note there, and public comment is through July 2nd. You can review the public comment brief on the MMS Hub and send any public comment to the team at Yale that I work with. again, heavily referenced gravity approaches throughout the measure, so it should seem familiar. Next slide, please. This is the first time we're bringing to you kind of an in-depth plan, and the plan is in process on what we're calling our Social Care Voice co-design project. For those members who've been part of the Gravity Project for some time, we've long heard feedback from our social care experts that our narratives and our models and perhaps even our terminology are too clinically focused to really represent the needs of our social care experts. So in partnership with Civitas and funded by Robert Wood Johnson, which the whole pilot work stream is right now, we are hosting 6 2-hour co-design sessions late summer to early fall, really taking great care to work with our social care experts to figure out representative members for that group. It will be an intentional group that's selected and will meet consistently over those 6 sessions. Things that you can ensure that the experts are trying to make sure that we consider are representations on population served, social risk domain expertise, and both strategic and grassroots perspectives. So we want to make sure we center the voices of the organizations that are directly helping people and not just strategic voices. The goals are to synthesize the wisdom from these experts and apply it to terminology and STU and the IG to better understand the problem space, to better understand differences between CBO subtypes so we can include them in our approaches. Lucy has a question, and then I'm going to absolutely get to you. Really trying to make sure that we better define our social care roles, requirements, and opportunities in our models and approaches. And beyond that ID and beyond terminology, we really just want to make sure that we understand and document general social care boundaries, barriers, and opportunities. This is not just focused on the ID and terminology, but it's really just a deep listening session with intention, facilitated by experts to make sure that we do a good job. Phase 1 is documenting the gaps in enhancement requests and proposed solutions, and then creating a report out. Phase 2 is prioritizing those changes with Gravity leadership in 2024. Lucy?
Yeah, Sarah, I'm interested to hear about this Social Care Voice co-design project. I just want to comment that a lot of people and groups have been dealing with this for a couple of years now. Mm-hmm. And I'm wondering what prompted Gravity and Civitas to decide yet another attempt is needed. And what are your assumptions or hopes to make this succeed where others haven't yet?
That's a really good question. So I'm going to state number 1, this has been the deep care and focus of our current technical director since he assumed his role, Corey Smith from the AMA. He has very much leaned into the space, and I think our sunsetting because of our financial constraints over the fall and winter obscured that to public view, that he was working so carefully on that and listening to people and making sure that the IG could evolve to better meet people's needs. So I would give a hats off to my colleague Corey. But also I want to center the grant itself. Robert Wood Johnson very specifically noted that we had to address a co-design problem and center voices, like to center correct voices and solutions. And this is just the perfect application and perfect use case for that grant deliverable. So RWJ said we had to do a co-design initiative. It was the collective epiphany that there was no better, more appropriate one than this. It has all leadership buy-in, the executive committee, like everybody is involved. And you can see we're actually accountable to implementing it in phase 2. Sound good?
That sounds great. That sounds great. I certainly wish you luck, and thank you to Corey and RWJ for recognizing how important this is. And I hope it works. Thanks.
I do too. Any other questions before we move on? I'm glad Lucy's been a constant. Lucy underestimates how crucial her own voice in this project was. I don't know if she knows how heavily her perspective is and was weighted when we consider this need. So Lucy, thank you for always advocating for the right thing.
Well, thank you, Sarah, but I thought my agent was on vacation this week.
All right, so more to come on this as the members and the participants shape up, but I'm glad it feels like the correct thing to do. Next slide, please. And next slide. This slide has evolved a little bit since we last presented it, and the reason being is we were putting things up here that were proposed, that some domains that were proposed, expanded coding for food codes, material hardship codes, and transportation and security, ICD-10-CM. Those things are still very much pressing, but the timeline to have them start was very, very shortly. So we pulled them for a really big reason is that we have a really wonderful member-led prioritization work to happen over the course of the next few months. We'll be analyzing every single thing in the backlog proposed by the community, proposed by members, and prioritizing things to put back on the roadmap. So as that work is happening, we just wanted to make sure that we were representing the opportunities that will come out of that work. So we're involved in digital access and literacy. Likely very shortly, the member prioritized new domains and use cases will come back on the model, and you'll see work and opportunities to engage in a new committee that is 100% geared toward that work very shortly. It's going to be called the Operating Committee. It aligns with other HL7 principles. It will have representative stakeholders, ensuring the social justice model of Gravity is kept through and through in everything we do. So more to come on that. Again, the Operating Committee is going to be leaning into the what work is next. So moving things proposed to the roadmap there. And again, those of you who knew the former version of the Operating Committee was the Strategic Advisory Committee. And we just want to make sure it has more teeth this time. So there's a lot of really great changes happening there. And we will be crafting both payer member and a selected and elected member voices for that committee very shortly. And again, not financial, that's the executive committee. This is really about the work we do in prioritizing it. Nothing else has really changed there for the name of the social care co-design. We still are about to publish STU2 V2.1. We're still doing the use case discovery about the eligibility of social care services. That's that work I invite you to attend at the Wednesday call from 1 to 2 and hoping to test at the CMS Connect-a-thon. The pilots work is still going. Our June pilot call is next week. We hope you come. We're going to be hearing a report out from both the CDC on the public health use cases and applications of it with one of our pilots. And you can see that social care co-design work, which is funded by RWJ in partnership with Civitas, is on the bottom there. Next slide, please. And any questions on announcements or the roadmap? And now we're going to move into the work because there's no other updates. All right. Sounds good. Okay, next slide. Next slide. All right, so this is the terminology schedule and activities. I do want to thank members for giving some comments by email. We really appreciate member engagement, community engagement on the deliverables. That meant that you reviewed them. So grateful. So we're on the June 22nd, we're in the concept identification phase. We have this meeting and another meeting to do the development work, really. And then we spend 2 meetings just assessing the completeness of what we've done. Plenty of time in those 2 meetings to add new things that are missing and take things away, but we still are in the proliferation work. You'll see a lot has happened since we last were with you, really, especially in the diagnosis realm. And then we spend 2 meetings doing end-to-end review, and then we vote in the middle of August. Next slide, please. All right, any questions? Again, homework remains the same. We'll review it at the end. We have we're in identification phase. This slide has not changed. This slide is just the way we do it. We have our subject matter experts, and we have some of them on the call. Thank you so much. And we bring the information to you, and then we go back and forth with the hopper, trying to make sure everything is right. Next slide, please. Again, this is how you access the masters. We just want to make sure that everybody knows how to get the information. It's all in the Confluence, ever so tightly organized now. Again, with support with Civitas and RWJ. Thank you so much for that. The Confluence got a complete overhaul over the last 4 months. Next slide, please. And next slide. These are amazing subject matter experts. We have the joy of meeting with them weekly on Tuesday afternoons. Incredibly grateful for all of their expertise. Next slide, please. Again, the approach to digital literacy and digital access is grounded in previous domains: digital literacy born from health literacy, digital access born from material hardship. Very much the same principles across both of those previous domains remain, needing to consider different skill sets, needing to consider within digital access, both environmental and personal drivers. Next slide, please. And again, just stating again, it's important to ascertain access prior to digital literacy, just to make sure, as much as we can try to be clear with our terms and questions, that's an important one. Next slide, please. And next slide. There are some updates. And so what you're going to be seeing here again, this is the first time we're seeing both existing terms that are already in Gravity value sets that we've built prior and suggested terms. So whenever anything is in bold, it means with a code, it means this is a previous code that Gravity has built that is applicable to this domain and use case, right? So able to afford phone is applicable, able to afford internet is applicable, and able to afford electricity is applicable, because of the amazing Asha reminded us on Tuesday afternoon, a computer is no good if you cannot charge it. The definition of adequate is reliable and affordable access to internet service by a personal device. This is in progress. It can be refined. An answer directly to Janice's question, Janice, we took it to this means, and there was pretty much consensus that although public access, access to instruments and internet in public facilities is really critically important, it's not directly aligned with the digital access definitions. And so it would be not reliable and affordable access. And this is where the personal device element comes in. The reason, that anchor that decision center in aspects of privacy, the full uses that one might have of the internet are not capable in public spaces. So it would not be a good place to have a telehealth appointment, or certainly a mental health appointment, and some of the things that one might want to do on the internet might not be able to be appropriate in library settings.
Thank you for attributing that to me. It wasn't me that asked the question. I think it was Lucy. I made the comment that I do have discount internet for $9.95.
Oh, my apologies.
That's okay. You can give me all the credit you want anyway. But I was just commenting, as you'll hear a lot of comments that it's not good enough, the $9.95 version, and it really is, because I remember a lot of digital stuff. If you have 3 kids, it might not be, right? Yeah.
And then Amy, do you want to speak to your question there?
Sure, and that is whether you're differentiating between whether people have mobile access, fixed access at home, or both. The reason for that being that the Infrastructure and Jobs Act, the Digital Equity Act, in its definition of digital inclusion, suggests that you need both. And particularly that mobile should be considered a supplement to fixed, but fixed should be kind of considered the minimum gold standard.
That sounds wonderful. And you can see a little bit of those themes. That's a really important comment. Thank you so much. We have SMEs who are logging this and making sure we talk about those things in our Tuesday meetings, but I don't know if we've actually captured that well enough here. So we're going to take that back and make sure that we can. And it might be better represented in the problem statements on the next slide. So I'm going to take us there together. So as always, when we do Gravity terminology, we build the problem statement and the positive statement, right? Because social risks are not just risks. I mean, social determinants of health or social drivers are not just negative. They offer both positive and negative forces. And we also build terms for care planning, right? So just as we build the negative term, which is inadequate digital access or something to that effect, we have to build a positive term where we're aiming for in care planning. And that's what you see here. Definitely not sufficient. I think I can hear what you're saying for representing both of those factors. But these terms also are able to be documented as like assets. It's for a different patient, this could be an asset, right? So let's go to the next slide, and then we can talk about whether Amy Schoen's very important comment is better represented here, or if we still have work to do. So, and it might be that we have to add in residence or, right, we have to make sure that we're thinking about the fixed element in our definition. And Amy just again, stating that. So what we are working on across both digital access and digital literacy are broad terms. And these broad terms are terms that are able to be built in codes such as ICD-10-CM, and more specific terms that we can represent in SNOMED CT. So the broad term that we're thinking of, in general, that might be able to be built into ICD-10-CM if we can get there, and it might need, the definition might need to be able to be refined to include that fixed element better that you're speaking to, Amy. Thank you, Walter. So we have unreliable and or affordable access to internet service via personal device, right? And these are the terms we have currently, right? These are things that were already built within the material hardship use case. So we have unable to obtain internet service in residence due to limited financial resources. We have Corey's here. Here, I just talked about you, Corey, in glowing terms. And you're here. We have unable to obtain telephone due to limited financial resources. And again, that term was built without the digital access use case in mind. It was built just for material hardship, so it's insufficient. And unable to obtain electricity in residence due to limited financial resources. So this is where we, and Walter's comment kind of relates to this, and you're happy, and because we're such a small group, you can definitely come off. What we're working on and trying to figure out how to fill these gaps that are noted by many of you is unable to obtain some kind of a personal device for internet access due to limited financial resources. And this could apply both to a cell phone or to a tablet or to a computer. We might need to make them more specific in order to meet different use cases, but that's a general concept that we're thinking about. And this addresses that personal access, right? I don't have it because I don't have the equipment, and then or the personal connection. And then we also are required to build a community level term, so lack of reliable internet service in community or place of residence, which would be the structural element there, right? No broadband or lack of cell phone service in remote Vermont, where I practice every single day. And Elena, hi Elena. So I'm just going to stop here and let people speak to some of these questions that I see in the comments. So I have Walter talking about access to phone and access to cell phone. That I think we absolutely, 100%, you're one of our SMEs, so we agree with you. And part of the problem is the previous terms that we have were not built with the digital access use case in mind. They were built just for material hardship, so we'll have to create other ones. We agree. Corey says adequate seems to be a relative term. Adequate to what? Adequate to view a large image file, adequate to send and receive. What are your thoughts on this? We have been talking about quality. Monique, do you want to come up and talk about how we're thinking about adequate within digital access, or anyone else from the team or the subject matter experts want to speak to that? I put you on the spot. I don't know. I think poor Walter was not at the meeting on Tuesday, so I do not want to put him on the spot. Who else do we have here? Adriana was there. We just briefly touched on access, but
well, and yes, Sarah, part of our thought on adequate and inadequate was we didn't get down to the sort of nitty gritty on this either, but the one issue that was already addressed was, is it adequate if it's just on a personal device, or should it be also on a fixed line in your home? So those kind of things we were still sorting out. So and I thought that was a very good addition by Amy.
Right.
And then it is true, the degree of, this one is going to be less of an issue with adequate and inadequate than when we even get to the ones where there's skills involved. But I think here we can probably land some kind of a slightly more specific definition. But I think here adequate is if it's reliable or stable. And again, what the definition of stable and reliable is, does it go out once a day? Does it go out 4 times a day? That's a little difficult to nail down. I don't think in this area there are as many specific guidelines as there are in the digital literacy area.
I'm just going to build off of, I think so what we can do is take these comments back and try to refine with that in mind, but understanding that adequacy will likely be applied to the use case that is relevant, right? So you're going to have, I mean, one of the things that we talk about within the digital literacy space is the broad range of digital literacy skills for different purposes. We were talking about this in our prior meeting, like basic digital literacy skills and digital literacy skills for advanced occupations, they're different. You can see that in some of our approaches and what we've done with digital literacy, but it seems like we might be able to need to put a qualifier on here of some kind of like to complete basic essential skills of life, or as we have in other areas of our work in digital literacy as well. We can consider taking that back, Corey. For Lucy's question, I just want to answer. So Lucy, this is the previous terms in residence are limiting. We had a huge conversation on Tuesday about mobile access for unhoused individuals. And that's partly why we evolved and why you can see the what we're working on codes, because not everybody who has internet access is housed, right? We're talking specifically about the adolescent homelessness population that are, the highest population of the most common experience of homelessness among adolescents is couch surfing. And so they might have internet access, but they might not be housed or formally housed. So that's why we had to adapt the terms that we had in material hardship. And then Amy is brilliantly talking here about many have episodic need to cancel service. So trouble paying might be better. Thank you, Amy. The other thing is the need to consider the whole family unit, e.g. husband takes the mobile device out during the day. That is also very helpful. Thank you, Amy. Gerardo is talking the service would be inclusive of coverage only or also due to temporary IUD weather related events. So Gerardo, this is partly where the community access comes in, right? Because we do want to be able to document when either there's chronic or episodic loss of service in areas. I think we were talking about Katrina on the call a little bit ago. Certainly in rural Vermont, the winter, we lose access on a regular basis for different storms and different climatic events. So that lack of reliable internet service in community would apply to that use case, and then the person would have their own individual drivers within that community. Amy says uses device that meets the user's needs. Thank you so much, because that includes access and it includes some of the differently abilities, and we do have some of those concepts that we were utilizing in health literacy, so we can pull them forward. And then to because access to electricity, infrastructure, and housing. So Bill, again, this is what Asha reminded us, is we needed to make sure that we did not exclude electricity as a digital access element, because you need electricity to power the access itself. And then Walter, yeah, so unfortunately, it's very hard for us to change what we have. We can do that. And so we have the existing terms. It's easier for us to make new things, right? So we already, if we want to, if we have the collective purpose to edit or change an existing SNOMED term, we can definitely do that. We do that all the time with SNOMED, but it's easier for us to make new things specifically to the digital access use case than it is to change something that was built for material hardship. And so Elena is saying that for data analysis, understanding the barriers to access, this is where it might be helpful to create specific subtypes, right? So maybe these terms are not granular enough, and we need to create subtypes of access that actually facilitate interventions, Elena.
Yeah, that's kind of what I'm saying. Because when I think of the resources available, financial like barrier versus the other types, right? Like power's going out because you live in a rural area. Those are really different resources and kind of different tracks for interventions as well. And from a population analysis around like, disparities and those kinds of things, separating out those two, I think, can be very important.
Yeah, and that's what we've tried to do in the what we're working on section, right? Is like there's the personal device and personal access, and there's the service and community, again, very roughly, but exactly for that purposes. And just of note, also like within the taxonomy, they're usually in different places. Like we think about IC10CM, there's community level codes, and then there's person level codes. We do not have to remove past things if we make new things. No, if we're able to argue that it's needed for a specific use case, we can just make new codes. Yes, Ruth, this is SNOMED CT. So what I'm just gonna try to synthesize. So we have Amy, very intelligent, thank you, Amy, talking about the need to have both fixed and mobile access. Appreciate that, and we'll try to make sure that's included in all of our definitions and the thoroughness of our terms. We have the very clear understanding that the terms that we have might not meet the unhoused individual's use case, nor specifically the digital access use case, because it doesn't center that it's a cell phone and it talks about in residence. So we're going to be needing to create new terms. We have a clear understanding that we need to create terms that talk about access in the community and access for the person. Oh, so Ruth, we'll try to we'll see if we can help you. It might be international.
Yeah.
Maybe I've
Yeah, sorry.
no, Hamal, you go. You can speak to this.
Yeah. So this code is currently in international version, and international releases every month. So we need to wait for next US release, which would be in September, and it will come in September. But if you select international at the very top when you are searching in Cinema City, you should be able to see that code.
Yeah, we do build with both US and international representatives in mind, because many of the terms we're creating are applicable to international use cases. Okay. Any other questions? Okay, we have a lot of things to take back to the subject matter expert meeting on Tuesday, right? Did I synthesize? Did I miss anything in my synthesis of what I heard from you all? I hope I didn't. I think I did. Luckily, we capture in minutes and we capture the recording. We'll review it if necessary, but I think, oh, great. Thank you, Elena. All right, so we're going to take all that back into the hopper and then bring it back to you in 2 weeks. Fantastic. Okay, next slide. Whew. The great thing is we're now into a bunch of things that have not changed. No additional digital access instruments or digital literacy instruments. So we did a really thorough job early. There are some instruments approaches out there that we're still trying to get. We know that the VA has a really good instrument. We're trying to get that from their ACORN screening tool. But other than that, we have a pretty solid set so far. And go team. Next slide. Next slide. And again, all of those instruments I just mentioned have been available on the masters for review for some time. And then they can be found in the Confluence for review as well. Now, if we thought digital access was tricky, digital literacy is also incredibly complex. Very grateful to bring this all to you. And this is like the best part of Gravity for me, is when we bring partially formed things to this brilliant collective and they all get examined by you all, just like we did with digital access. Like, definitely not nailed down, a lot of work to do. Looking forward to doing it with you all as we go forward. All right, and very glad that we have some subject matter experts here in the call to assist. We have Adriana Nava from NCQA, we have Walter Suarez, and so I think that's probably, it might be it for now, but very grateful. Okay, next slide, please. All right, so our approach to digital literacy is built on the idea that we understand, again, different use cases for different levels and granularities of terms and different capacities to build these terms into different terminologies. So this is a page that has the highest level terms that we have in process right now, right? So inadequate digital literacy skills or adequate digital literacy skills. Again, those top level codes that do not go into any of the granularity that we were mentioning before, very akin to the digital access terms we were talking about before. The current definitions are the most stable ones, even though we have other definitions in progress. American Library Association, Lucy, right? So this is a very common definition out in the ecosystem. The problem is it doesn't include some of the fundamental skills that are critical for digital literacy, so it's incomplete. We have been working on other definitions collectively. Of note, the definition we've created definitions for almost every single other domain together. So we probably will have to do this again. I do not, thank you. I did not put them here though, because they're really a work in progress. But the idea is basically that there are these two meta terms. And again, these would be applicable to ICD-10-CM. The problem is they do not contain the safety and privacy elements. So more to come on that. Next slide, please. So this is when we get into the subtypes, right? And we talked about the approach to this last meeting. I'm gonna just slow things down again and talk about the approach again. There is a need to document basic skills that are lacking, that need to be like optimized across multiple different use cases for the people we care for across all social care settings. Outside the healthcare use case, for the education use case, for occupation, for engagement with, for applications, for all kinds of different elements, right? So it's important to create, if we can, terms that talk about basic skills and terms that focus, again, on the specific subtypes of skills that, as Elena mentioned, for digital access, can be aligned with specific interventions. This is the way we've talked about it through Gravity all along. So there's questions on instruments that highlight these subtypes. There's going to be terms that highlight these subtypes, and there'll be interventions that are able to be applied for these subtypes, right? So there's like a mapping of instrument questions to outcomes and diagnostic terms to the interventions that we do, right? And that's one of the things we think about when we're thinking about whether or not we need to make a specific term, and Elena made that use case of digital access. I need to know whether I'm addressing a problem for the person or a problem for the community before I pick an intervention, right? And that means I have to have two different terms, because if it's like that, it meets the use case, right? So there's a significant framework for organizing digital skills. Lucy, yeah? Before I go into the terms?
Digital literacy has sort of taken over life. And so that's one reason that our incredible discussions can be so wide-ranging. I'm thinking about the title of this slide. What if it said, subtypes of inadequate digital literacy for health and social services interventions? I think that's what you just said. When you and all clinicians and social service providers do an assessment, the reason is not just to collect data. Yeah. It's ultimately to determine an appropriate intervention, and of course to get paid, both of which are going to end up as SNOMED or other codes. So I'm wondering if it would help when we talk, and any of these slides, Sarah, inadequate digital literacy or adequate digital access, they should all be titled for purposes of health and social services interventions. So we're not thinking about, do you need this for your job? Do you need this to keep track of your kids? Would that help?
I think it might help. I think it looks like Monique has a comment.
Yeah, you want to go ahead first, Sarah?
Is it an answer to Lucy?
Yes, it's partially, yes, because Lucy's thinking along the lines that we all were thinking along. And I was initially thinking, as Lucy was, around, is this just in the context of healthcare, for example, or just in the context of, getting social interventions? But I think and this is where we're having trouble putting a boundary on these digital literacy skills. There's digital literacy skills for life. There's digital literacy skills for work. There's an overarching term for digital literacy skills. And I think that, the context in which we use them is going to matter. But I do think that even they matter just not only related to social determinant of health interventions, they are for social equity. Not having these things may affect, just like not having a car may affect more than just going to your healthcare appointment. It affects your work, it affects everything. So we still are working on that boundary, I think, Sarah, and that's why this is a bit loose still, but we're trying to find some, scope to this.
Lucy, did that help with an approach? I think we can probably.
Yes, I'm glad. I'm obviously, I'm very reassured that great minds think alike and that you're struggling with this boundary issue.
We are
That's the
struggling.
perfect concept for our struggle, and we'll be doing this constantly. And yes, okay, I'm going to stop there. Thanks, Denise. Monique. Thank you, Monique.
No problem.
And then, so usually adaptive devices are contained specifically within the domains that address differently able people. I mean, not specific, not in this area, at least not directly in the schematics and the skill sets. We've collated, I think, like 8 or 10 different ways of organizing the skills. But am I incorrect there, Adriana, Walter? I think that usually the adaptive devices are contained specifically within other domains. Is that correct? I haven't seen them in our digital literacy skill sets yet.
Yeah, we haven't seen that come up yet. A lot of this was on the basic foundational skills of like use of the computer, use of mobile telephone, for example. There was discussion of like more specialty items, maybe for example, like insulin pump or something that might require a little bit more specialized equipment, which it sounds like this hearing aid or some other things might fall into, but that was something we would have to explore a little bit more. And we were focusing right now on just the foundational pieces of having access, or I'm sorry, literacy to using a computer and a phone.
Great. Okay, great. Thank you, SME friends. And then Walter also answered in the chat. Thanks, Walter. All right. So all that being said, the grounding, the boundaries, some of the comments on adaptive devices. We did address adaptive devices extensively in our health literacy work. So we can, there's some really beautiful conversations we had last year regarding adaptive devices and literacy and health literacy, which we can always go back to. But so we have this organized as follows. So we have these foundational skills, which are turning on devices, using controls, using menu settings, connecting to the Wi-Fi, using an internet browser, keeping information and passwords and accounts secure, and updating and changing passwords. I'm horrible at this. This is why I have to have a curator. I have LastPass. So that's the foundational level elements. And again, this is common across the UK framework and then also across adaptations in the US environment and applicable to all of those different skill organizations that we've curated, whether it be the ALA or the US Department of Ed, or some of our papers that our subject matter experts have written. So these are common themes that we see, again, across both US and international applications. Then there is the inadequate essential digital skill of communication, right? So you have your foundational level skills and then you have communication skills. There is a wide range of this, and Corey, this is partly where we're starting to put boundaries on, and Lucy, this is to you as well. So what does adequate mean here? Digital communication can be everything from creating a beautiful piece of like a graphic design on Canva to just basic communication. So for the purposes of our work, again, creating boundaries, it's using email, messaging apps, text messages, and social media and video to communicate with others, right? Understanding the breadth, this is what we're saying is the essential element, and it aligns again with those frameworks that we mentioned before. And then digital information handling, again, there's all kinds of sophistication here. Again, in referencing both the UK framework and its applications in the US, we have we have using search engines to find news, health information, and other information of interest, recognizing the trustworthiness of online information, streaming or downloading online movies, music, games, books, and other content. Yes, we can. So I have to say that, Walter, now that we're doing this domain, I recognize my opportunities for enhancing my digital literacy all the time. And the team knows because I joke about it now incessantly, because I am a 49-year-old woman who has all kinds of things to learn. And so it happens to me on a daily basis now. So Elena saying, I presume there's conceptual linkage here, right? Like with the adaptive text, I started catching up and making sure I know the structure of the Venn diagrams. So we did talk about adaptive instruments adaptive elements a little bit ago. And so Elena, do you want to just hold, I mean, do you want to speak or do you want to just?
No, I'm just putting a note because it's my ignorance of some of the processes that's already been done. So I'm just more just, you don't have to address it right now. I'm just asking that question.
We will make sure that based on Denise's question and your question, we reinvestigate how adaptive tech integrates with digital literacy. On Tuesday, we'll take a deep dive on that and come back to the next meeting. But so far, it has not been contained in the basic fundamental skills of digital literacy and the literature that we found. It'd be more found in the literature of ability advocacy, so far as we've seen, but more to come. We promise to do another deep dive and make sure we're not missing anything.
Sarah, I'm just going to say that this last bullet, stream or download online movies, music, games, from my limited healthcare and social services interventions, I find this bullet outside the boundary. I don't know what other people think of that, but I don't see why.
I would disagree.
I agree.
Only because from a clinical lens, I've had people like stream YouTube videos for grounding activities or meditation, things like that. So I don't know. I feel like there's a lot of interventions that overlap with this.
Well, it doesn't say, Alana, it doesn't say video. It says movies, music, games, books.
Right, but like I'm thinking like of a streaming platform that where you're going to access types of things that are part of your intervention.
I do think it's contained in the intent, Lucy, and it might be within the other content. You know, I hear what you're saying, and again, we also have to think outside the healthcare use case because I think about, education barriers if you're not able to stream online lectures, right? So, there's a whole virtual community college track for rural Vermonters, right? So I hope that, did the answer, do you feel comforted by the answers that people have given you?
Yes.
Great.
I just have to unzip my little mind and realize that, yes, okay, fine. Thank you for this sidebar.
Wonderful. I have a very persistent cat who's trying to come into the view. All right. Okay, so if we can go to the next slide, because I just want to make sure we get through them. We're doing a really good job on time. And so the next essential skills are in the area of transactions. And again, we think about use cases outside healthcare. We think about, taxes and bank management and, all of the purchasing that we do. So this is access and use public services and assistance online, such as applying for services and paying bills, purchasing goods or managing money and financial transitions securely online. And again, there is a wide range of skills here. Again, thinking about the boundaries, the basic ones as defined in the literature. So there's helping us ground ourselves. There's a whole lot more of transactions. We could go to Bitcoin, but we're not going there, right? These are the basic things that that are part of our inadequate, adequate. We like cats. We do like very large Maine Coon cats right here. So the next one is digital problem solving skills. Again, all of these skills are associated with the literature across the ecosystem. We were just trying to organize them and very grateful for the UK framework and the adaptations from our subject matter experts that let us. I know I won't. We promised not to, Jonathan. I was just saying this is why we're having boundaries here. Problem solving is using online resources, including online tutorials, facts, and forums to solve problems and search for information. And then this is that really critical one that's missing in the American Library Association definition, but is common across all the different structures and taxonomy of skills that we have, which is that critical element of safety and privacy and legal skills, right? The basic tenets, there's a wide range of skills here, but the basic ones, again, the boundaries are keeping online accounts secure and private using robust passwords and privacy settings, assessing risks and threats involved in being online, and recognizing and avoiding suspicious links, emails, websites, and social media. I can say in rural Vermont, this last one and financial abuse or financial, so abuse isn't the correct word, but elders, rural elders and scams, and what I become involved in as a primary care provider it's not a rare thing. How I assist my patients in gaining back their autonomy and fiscal sovereignty. So these are the core skills that are across all use cases, again, gathered from the literature. I just want to make sure that we are, yay, thank you, Amy. Oh yes, so we have a little bit of that in the next one, Walter, with the healthcare use case. And then great, thank you, Denise. That's a nice statement there. Wonderful. All right, so next slide. This is that healthcare use case, right? Specifically, and Lucy, we leaned into this a little bit because of some of your brilliant comments regarding this is a problem for whom, right? So we don't intend to build specific terms for every single different use case, employment, education, etc., right? But we do have precedent for building specific terms that address the healthcare use case because of the anchor of our work, right? And the COVID experience that we all just had, we know how critically important this is. In rural Vermont, this is also critically important in the telehealth world. So we are playing with this concept of difficulty accessing healthcare due to inadequate digital literacy skills. And this is where you have difficulty demonstrating use of telehealth equipment and patient portal access. We're considering how it would apply to remote monitoring devices. Again, the precedents, we did something very, very similar for transportation insecurity. We were able to center on transportation insecurity affecting healthcare access. So there's precedent for going to this term if needed. And again, from a clinical perspective, this is incredibly helpful because in the grand scope of all concerns with skills, I can say that the absence of skills is directly affecting my patient at this time and then refer for intervention. Any thoughts here? Amy, that's a really good thought. So can this be broader than healthcare access, but rather health in general, thus finding reliable health information, finding a support group, finding healthy food? That's a good thought. Oh, I have health repeated twice too. So it's health. So Amy, I think that seems very reasonable, especially since most of the interventions, like for instance, just the other day, I was trying to teach someone the 4-7-8 breathing technique in order to assist with their dysregulated sleep patterns and in a history of trauma. And I referred them to Andrew Weil's YouTube video, right? And send it to them, right? So that is health in general and not just healthcare, but I think it's important to note that. Any other comments, Gerardo?
Yes, thank you. This is very much of my interest in particular. Also, perhaps to include here public health data. And with that, and I think that you showed some of this when you were showing the foundational skills for digital literacy. The analysis of images and numbers for the understanding of this information. Again, I think that you mentioned that there was no granularity in the definitions or foundational skills. I just wanted to make sure that that was also part of it.
Can you repeat your question just so I better understand? I'm so sorry. So I missed the first part.
I was just saying to suggest to include here public health data as well.
Yes, okay. Yes, I heard that part. So fantastic.
And the second part is if this would have more granularity to include skills that are directly related to or a combination of health literacy and digital literacy, such as the analysis of visual aids, charts, graphs, reports, etc., which is also a combination with numeracy as well.
Very good question. We already addressed health literacy, so we have to be careful to keep the Venn diagrams a little separate, right? We can bring those concepts back in 2 weeks, but we will take that consideration back when we to our subject matter experts and see if we can figure out. But I think the public health element is very, very important. And And then we have a couple comments. Was that a good answer to your question? I hear you on the public health. We'll try to figure out how to not overlap with things we already did with health literacy. And it might be helpful for everyone to see what we did with health literacy. And we can bring that back next meeting.
Sarah, there might, kind of related to that just previous comment, you know, I think of how like the digital literacy around like public health warnings, like, so we have the public service shut off warnings, right?
Yeah.
So is perhaps maybe that's where that kind of specific granularity maybe could like live related to public health, right? Like, hey, your power's about to be shut off. There's notifications going out. Like, if you have this alert app or you don't, or those kinds of things.
Yes, that seems brilliant. Right. So I signed up for text alerts for my public health entity and they come to my phone, but that's a digital literacy skill. Right. And so noted. And then Corey asked another good scoping problem. I think that we can craft a better definition that allows for essential equipment to evolve over time. Right. So we're not limiting. Like, I know there's some thoughts regarding, rural physical therapy with VR, right? Because the inability to get a physical therapist or get someone to an office. So noted, I think our definition is limited here and it can be worked on to meet that use case wherever it's important. And then, okay, that's nice comments. Okay, digital skills. Thank you, Amy. Any other thoughts on, again, sorry for the repeated health. I heard expanding for public health. I heard a need to refine the definition to meet more inclusive use cases. I heard, and then we have, yes, and then Amy, certainly many of the many portal skills are an intersection between digital literacy and health literacy. And again, that little, like, trying to keep things separate. We actually, again, this was born out of health literacy as a domain a year ago. So, so we'll bring all those terms back and see if we can make sure that we're thorough, right? We want to make sure we're able to document the complexity of the problem without creating confusing terms. Are we good? Lucy?
Yeah, I wanted to respond to Corey, who's raising a really interesting issue. One of the problems we all have with, I don't think anyone in this call probably has digital access problems, but we may all have one or another digital literacy problems. And one of the reasons is that the technology changes so fast. And so maybe one boundary to think about our task this summer is just to deal with, in general, on average, the best for the most, like augmented reality headset. How many people are going to do that? Interacting with a voice assistant. If you're really severely handicapped, maybe you need to do that now. But I guess I'm trying to set a boundary here, just like somebody said, don't do cryptocurrency. Let's not go to augmented reality headsets or other things that some of us might actually know about, but aren't going to be widespread enough to matter, in our humble opinion, for the next year or two.
Yeah, and Lucy, yeah, just to add to that, this is Corey. Yeah, I think my point wasn't so much to add the new technologies that are coming, but I think more but to highlight that in this particular area, the technology does change more rapidly than some of the other areas that we think about. And how do we, from a terminology perspective, ensure that we, aren't, that the terminology holds up for a period of time, or that.
Well, the answer to that, Corey, is that we keep meeting for the rest of our lives.
Okay, sounds good.
Okay.
Well, and one thing I'll add is that, this is going to be, something that we just can't kind of make up. I think that just like, cancer is staged against a version of staging criteria, I think that digital literacy may have to be evaluated against some version of digital literacy skills at the time that it's evaluated. And like that framework has 5 for communicating, for example, and those are 5 essential life skills. And, if that turns into some kind of a survey or questionnaire, can you do those 5 things? If you can do all of them, you have all the skills. If you can do 1 to 4 of them, you have partial skills, and if you can't do any, you get rated at a 0. And partial and 0 may be a form of inadequate, but they may be differentiated out. And adequate may be having all 5, but there's got to be some kind of time-sensitive criteria to judge against when digital skill sets change over time fairly significantly, at least in the last 5 years. What even is considered a digital skill?
And I do feel like by leaning into the healthcare use case specifically and creating a more inclusive definition, we're able to meet the use cases where it's actually really critical, right? To have what might seem a very sophisticated technology to address an inequity or address a specific person's healthcare needs, right? So I think we can fix the definition to make it, to give it room, because again, this definition is for healthcare use case specifically. It's not, the VR is not included in the basics, in the essential skills that we had on the previous, across all use cases on the previous slides. I think we can do a little bit better and find a happy medium. Thank you, Elena. Lovely. And Monique, yes, she's brilliant. We're lucky to have her. I think we're in a pretty good spot. And I just want to say, so Lucy, we have one more comment, but Lucy, Sarah DeSilvi, when I attend the Office of the National Coordinator Health Information Technical Advisory Committee meetings when I'm in clinic, I often lose access to the internet because I practice in deep rural Vermont. So my own clinic where I am practicing medicine loses internet access at least a couple times a day because of rurality. Right. So the access thing is definitely unpredictable up here in the hinterlands. We have a comment here. I don't know who. Yeah.
Sorry, Gabriel McLaren from Florida Blue. I'm sorry. I'm thinking about this and how difficult it is in a lot of cases to make sure that the problem is a person's digital literacy when you don't see the person's setup. And maybe it's the fact that I had issues logging in this morning, and then I realized my caps lock key was on, and then that messed up my password. But this is not something that a person generally leaps to admit. And you don't know if the hardware they're working off of is outdated. You don't know if you're trying to get them to load something that's just not compatible with whatever. They might have a virus. And I'm just trying to think about a higher level of generality that, if you're not certain that the problem is the person rather than what they're dealing with that you can't see.
Wise. Okay, well, think that's a.
Sorry.
No, that's like we have that someone. Sorry, can you repeat your name, because again you have your D7S5.
Oh, Gabriel McLaren.
Can you type it in just so we can get it in a minute? Thank you. So it's interesting. So this kind of goes back to what we were talking about in that grounding slide of needing to assess access before you assess literacy, right? We do have really good, wonderful. We do have really good, we do have questions that help elicit this or that, but in conversation and experience, it might be tricky. So I think we'll take it back to the SME hopper and see if we can figure out a path forward on that. Does that sound good?
Yes.
Wonderful. Any other thoughts?
Maybe the best we can expect is that they adequately diagnose.
Haha. Nice joke there, Lucy. Always with the humor on a Thursday afternoon. I hope you can expect me to adequately diagnose when I'm in clinic.
Definitely.
All right.
More reliable than properly, according to who properly, and so forth. Okay. Thanks, Gabriel.
Sarah,
Yes?
this is Denise. Real quick, I'm having trouble typing. That could be digital literacy. Anyway, when we say difficulty demonstrating use, well, right here, did we start out recognizing this could be cognitive too? I'm just thinking sometimes we have a brain fart like the tab key, but sometimes people have difficulty because of memory.
Mm-hmm.
Did we address, when we started this, I saw 3 types of states, and I can't go back right now because I'll lose the space. Hopefully I'm making sense.
You're making sense. And I think this
Okay.
goes into the adaptive technology element, right? So it makes me think about the adaptive technologies that we centered in interventions with social isolation, given the heavily aging and often with concurrent memory problems population.
Yes, that's where I'm going.
Yeah, I hear
like
you.
me, I'm starting to go, what
No,
did I do?
no, but yeah, so again, the basic skills, I think that we covered that with basic skills right now, when we already addressed the specific, the more advanced adaptive elements. We need to take back to this meet on Tuesday and ensure that it's not this domain, that it's some other domain. Like, we need to figure out how to approach that. Monique?
Yeah, and Sarah, one of the definitions, and I don't know if we removed it because we didn't want to, included technical and cognitive in the phrase. I remember one of the definitions you originally had, and maybe we have to, I don't know if that was in the ALA one or if it was in one of the other ones, but I think we have to work the cognitive piece in, you know.
So if we go back a few slides.
But that's like the overarching, I just want to make sure I'm understanding, because yeah, I saw the cognitive in that first definition, but it like stands.
Yeah. Okay, anyway, I think that we need to figure out all of the elements regarding adaptations needed, and take this into the subject matter expert meeting on Tuesday and keep on talking with you all. Because I don't know if that's the same use of cognitive in the definition that we're talking about right now with Denise. But we can think about it. Again, we'll go back to the hopper. Well, yes. So it was here. We can go back to it. I think we're almost closed. We're almost ready to close. We do have time until 5:30, but let's go back a few slides just to have everyone center on the meta definitions again. There we are, right? So this is the base American Library Association definition that's revised, right? And then what we need to figure out is how differently abled individuals and their needs fit into the digital literacy framework. We did a very good job of that with health literacy, and we need to take it back to digital literacy and just try to figure it out. So Adriana and Walter gave their initial review, but I think we need to think about it again. We thought we need to think about it with access and literacy. You're not getting old, or maybe you are, we all are. Does that sound like a fair thing? This is a very kind of a common finding across digital access and digital literacy from today. We need to figure out adaptations and accommodations and how they fit into both of these elements. Sound good? And I'm going to bring back how we did it with health literacy. Okay.
I think also, I will just say, like, in all the years I worked for the Alzheimer's Association, one of the things that, came up around, what is access is like a tool is as helpful as to use it, right? And so it's like often a varying thing. So I think like I don't know to what extent, like, if I think it's like noting that there, but I think the actual access piece, sorry, I'm thinking out loud.
You're doing great there. We're with you. So this is we'll keep on pondering this one as we go forward, but I think we're doing pretty good. So if we keep on going back, right? So we center back here just for everyone's reference. We're going to take back these considerations on Tuesday. We want you all to think about them as well. And so we can collectively come back in 2 weeks and start and keep on going. Next slide. Right. And so this hasn't changed. No new literacy instruments. So we can keep on going through all of those. And again, if you've seen them on the good thing is, if you do a deep dive into these instruments, you'll see questions that align with many of those skills. So there is a mapping of the questions depending on the robustness of the instrument, of the questions to the skills we're talking about. Next slide, please. And I think keep on going. All right. Okay, so we had a broad conversation on the definitions. This is when it starts to get meaty and philosophical. We've had all kinds of nice action items that we're going to take back to Tuesday. Any questions before we have a couple little summary things and then we're going to close out. It was a wonderful conversation today. Very grateful for all of you. Okay, so next slide.
Sarah, maybe you should move your clinic to wherever you're talking to us from, because you seem to be pretty reliable there.
That's my house. Yeah, so I'm in my house today.
Yeah, so move your clinic to your house.
But then I wouldn't practice rural medicine, and I love it. So I live in a city. I practice in the country. I drive north to dairy farms. I don't think I can do that, sadly.
I see.
I face the same connectivity problems as my patients, and we're in it together.
Okay.
Next slide, please. This is just the refinement slide. Next slide. No changes here. We just are thinking about these the updated definitions for coordination. We centered on approach last time. Next slide. No changes here. I tried to change the font color. It looks like it didn't come out. This is an updated definition for referral, which is more inclusive. Next slide. This is the new activity. Again, no changes here since we last presented it. All of this will be part of the August 17th vote. I think given that there's been no changes recently, we'll probably take these slides out and just know that when it comes to August 17th, we'll be voting on these things too. Next slide. And next slide. All right. So the big thing to do before we come back again in 2 weeks is think on all the things that we've just been talking about. Think about solutions to some of the problems we have and come back in 2 weeks ready to offer them. Even if you just offer complexity, more complexity and no solutions, that's fine too. We're going to be doing the same in the SME meetings on Tuesday afternoons regularly. So grateful for our subject matter experts. We have specific action items we're going to take back and bring back next in 2 weeks. Catch up on materials on the Confluence. Review the masters. They'll be posted tomorrow at 5. Look at those instruments if you want to. Think about the definitions we're forming, and then come back in 2 weeks and we'll see you all again. Next slide. This is where you find all of the meetings, right? So this is us here Thursdays 4 to 5:30. The technical work stream, again, thinking about connectathons and the eligibility use case, is Wednesdays from 1 to 2. Right, it's the same week as the public hall, which is helpful. The pilot work stream, that's next week. It's the last Thursday of each month. And again, it's in partnership with Civitas. That's from 2:30 to 4 o'clock Eastern Standard Time. So this month, I'm not speaking for 5 hours straight like I did a couple weeks ago. The 2 terminology and technical meetings are available on the HL7 conference call calendar under Gravity is a Filter. And thanks so much, everybody. Wonderful conversation. Again, as always, if anyone wants to become a member and support this work, you can look up information on the Confluence page, and we are very, very grateful. We're getting close, friends. See you all in 2 weeks.
Thank you, Sarah.
Thank you, everyone.